Welcome back, my friends, my guys, to this series on SYNLAB Podcast. I don't know if you can tell, but I'm very excited because I've been having a good time. I have been learning a lot about our skeletons, but just going beyond that, we're learning the truth about our bones. And with me has been the wonderful Dr. Akinmokun, who has been, teaching us so much. I'm living here with my mind completely changed about bones. It has done a 180 degree in my head. And I know that the same has been happening for you. If it has not been, it's because you've not been here since the first episode. So go back and start watching it from there. And if you've been here since the first episode, I want you to do me something. I want you to leave a comment telling us what you have learned so far. I expect that comment to be very long because me, as I am now, I can write paragraph. In fact, I'm leaving here to go and start telling people about their bones because I've learned enough. So I want to see that comment. I want you to also like this podcast. I want you to share it because everybody needs this information, and subscribe both on YouTube and Spotify. Thank you very much. Thank you very much, Doctor, for being here with us.
Thank you for having me.
It's been wonderful, really wonderful. So on this final episode, as we round up, we want to know how to, leverage the power of knowledge and see how that can help us to live longer. So the first thing I want to go in is, given that the issues with bones are very silent, the fact that people don't know much about what is going on with their bones, how early should one, or what specific time should we start checking our bones? When is the right time to start?
Thank you very much. What we advise, or what has been advised, is that if there is a family history of osteoporosis, such a person will be advised to check their bones much earlier, from age 50. Okay, especially for women.
Okay.
Once they are postmenopausal, then you need to, or perimenopausal or postmenopausal, then you want to make sure that you check your bone as early as possible. For those that have early menopause also, they are advised to also check their bone. We talked about DEXA before, dual energy X-ray absorptiometry.
Yeah.
That's a test that is being done.
I was going to ask
help.
about the test too.
Oh, okay.
Thank
sorry.
you for
I'm
mentioning. I'm actually happy you brought it up.
That's the test actually that is done, And so from age 50 is advocated for that. But for those that never had family history, just want to check their bone from age 65 is something that we advocate, that has been proposed for women, really.
Okay, so if you're still very young, you don't really need to worry
about so that. That's the reason why. Okay, probably maybe I'll just say this. Like we said, we talked about people, family history. There are some other people also that might have had issues with their vitamin D level when they're young, and then they could have osteoporosis early in life. Okay, so when they have issues like that and they've been seeing doctors can ask them to go and do their test also. So it's dependent on what the doctor finds out, on the interaction with the person, really, that will be able to say, okay, let's go and do a test now or not. But otherwise, we wait for age 50 for most people, or age 65. Yes.
Okay, so when you have started testing, right, how often should you now monitor it?
Yeah. For monitoring, actually, is between 2 to 5 years. Like we say, it depends on the severity also. Yeah. So for people that you think that the condition may be severe in them, we want to make sure that at least every 2 years, they go back to go and check. Don't forget, it's an X-ray. When we talk about X-ray, it's ionized radiation. And so it's not something that you want people to do often. Okay.
Yes.
So if between 2 and 5 years, depending, that's when people start to monitor, and then they can monitor based on that, really. And then once you get your score, you compare the score, and then based on the score, things can be done. For those, once X-ray is done, the DEXA is done, and you find out that probably maybe they have osteopenia, you can actually start them on some medications. For those that have osteoporosis also, you start them on medications. And then all the other a lifetime motivation we talked about also. You make sure that you advise them, and then make sure that at least those activities are done,
Okay, so we're going to stop here because I know with the question I'm about to ask you, you shed light on it in a previous episode. So if you're watching this, I want you to tell me, because I'm testing you now. I'm your examiner. I want you to tell me like what the test. Doctor just mentioned it like recently, but the test and what they measure for, when they are testing your bones. So you can just tell me that. Let me see how smart you are. Me, I can remember, but that's for me. I'm the one that holds the mic. So, Doctor, can you help us shed more light on that just a little bit again? For those who missed it or have forgotten, you mentioned the test, but what exactly is being tested for when we go for this test?
All right, thank you very much. So the test, we call it dry energy X-ray absorptiometry. I will just break it down a bit so that we get to understand what it is. Dry energy means that the X-ray that will be shoot will be from two sources. Okay. And what it's trying to measure is the rate at which the bone absorbs the X-rays. Oh. Okay. So when the test is being done, two sources of X-ray being shot to the bone, and then it measures the rate at which it's absorbed. And like we talked before, the score that we use, okay, is called the T-score. All right. The T-score from -1. Okay, so the T-score actually, what it does is that it's measuring the density of the bone, the bone marrow density, the bone mineral density of that particular bone against an healthy bone. So studies have been done in elderly people, and their data has been stored in that machine. And so when the test is done, the machine will compare what it has measured against an healthy bone. And then based on that, be able to tell you your score. Okay? We call it, like I said, the T-score. Now, the T-score from -1 and above is for normal people. So once the T-score is that, you know that your bone is fine. But if it is between -1 and 2.5, that means the bone is osteopenic. Exactly. And if it is less than 2.5, -2.5, that means it's osteopenia. Osteoporosis. Thank you for that. Osteoporosis.
Yeah, I'm a good student.
Oh, you are. I can say that. You're very brilliant, really. And so once that's how we make our diagnosis. And once you can make your diagnosis, then you'll be able to tell the person. And it's better the test is done before somebody sustains a fracture. Really, because for people that have osteoporosis, the risk for them to sustain fracture is very high. I mean, like we said before, fall from standing height can even, like I told you, somebody tried to carry the person and the person broke a bone, and I don't want that to happen because, broken bone can be very painful. And then such a person, you may have to subject them to a form of treatment. And there's no treatment that does not have its own complications.
True.
Either you decide to operate or not. Yeah, exactly. So you just want to make sure that, it's better prevented than having to treat a fracture. And so it's better the person gets to know before fracture happens, really. And that's how we do the test.
Okay, so I think like my next question will be, if you're a doctor, and I know that this happens in your practice, but when a person is faced with early, an early onset of bone loss, like maybe that your bone is having problem, and you are just looking at those test results and you've told your patient, what's the next step for that person?
Well, the first thing you want to be sure, like what we say, depending on the age, we know that as people grow older, they tend to lose have bone loss. And so if it is a younger person, you want to find out why it's happening. Okay? Like we said, people may have issues with their vitamin D. People could have underlying conditions that's making them to have that. Some people could be on some medications that's making them. So you need to first of all understand why it's happening. Okay, for a younger person. And once you know the reason why it's happening, you want to see if you can modify that.
True.
Okay? Because if you know that there is source of a thing, if you modify what is happening, then of course that can help really. And so that's number one thing you want to know. Then after that, you want also to make sure that at least this person is treated. All right. So medication, like I said before, that medication that can help build bone or the one that can help prevent losses. So you want to make sure that at least you start them on something. And then also you want to make sure that also calcium, you want to make sure that at least their calcium intake is increased. And every other thing that they will need, the minerals that they will need to help them build a bone. Because the main aim of your treatment is make sure that you want their bone to be built back, to the level that the risk for the fracture will be reduced. So it depends on the age at which the person is coming to you, okay? And then you will treat them appropriately, really. And that's the reason you must make sure that at least you visit people that know how to treat these things. And we're a lot of orthopedic surgeons all around.
So what would you say? Because this is taken from your last couple of sentences. Would you say that people try to self-medicate for bone loss? Is that something you see where people try to treat themselves?
Not really. I mean, it's why you know that you have bone loss that you say you want to treat yourself, really. A lot of people don't even get to know that they have issues.
Okay,
really.
So this is because, we have a lot of self-medication when it comes to just people. That's why I was curious about it. Like, are there people that try to treat this thing by themselves?
No. So what I'm saying is this, we have a lot of people. I mean, okay, so I once saw a patient that had a particular pain somewhere in the body. Okay, in fact, knee pain. And then the person has been on prednisolone for a very long time. And this was not prescribed in the hospital.
The person prescribed it?
Yeah, he said someone told her that prednisolone is very good for pain. And so she decided to buy the prednisolone.
Without even finding what was causing the pain?
She was taking the prednisolone. So we have a lot of people that actually go to buy things for themselves because they feel it's good for them. And they start to use them.
And they don't even know.
Oh, yeah, they don't know. They don't know.
And then, that could complicate issues, couldn't it?
Oh, yes, definitely. It will complicate issues. So if such a person now comes much later with a broken bone, you start asking yourself, how did it happen? Apparently, it's because the person had decided to take matters into his or her, his hand or her hands. And that's the problem, really. So I always tell people, there's no need for you to self-medicate. I know the fear of going to the hospital is always there. Yeah. And then also sometimes because of a lot of people going to the hospital, especially the public hospital, people are discouraged from coming. But like I tell people, why don't you just try and just, in quote, either put it, allow that process to happen so that at least you'll be seen by the doctor and the doctor will be able to guide you appropriately.
Prevention is better than
it's
cure.
It's always better. It's always better, really. It's always better.
Okay, so please let's all make sure that we're going to professionals, the people that actually know what they are doing. I can't imagine myself having a pain and thinking that I can treat it by myself. Given all that I've learned today, I should not even try that one because I didn't know anything. And yet we tend to think that we know. So as we round up this episode and this entire series on learning about our bones, I'd like to ask a final question, which is, how does bone health connect to, our overall health and, life, the longevity of your life?
Yeah, it does really. I mean, in fact, let me just put it this way. Every organ in our body actually contributes to our longevity. And there is this saying that the stronger your legs are, the longer you will live. Okay? Because movement is life. Movement is life. And so, bone health, having to make sure that your bone is strong enough, having to make sure that at least mobility is not disturbed, having to know that you are not losing bone unnecessarily, having to know that you've built enough bone mass when you are much younger. All of this will actually contribute to longevity. And then studies have already also shown that people that break their bone following osteoporosis, and if the fracture is not treated on time, the likelihood that they would die is much higher than their peers that has not broken the bone. And so, please make sure that you pay attention to your bone health. Make sure that you pay attention to your body, or in fact, every part of your body. Like we said, because the bone is hidden within us, so it's not something that we would care for, really. Yeah, we don't think about that, really. But it is something that from now henceforth, you need to pay attention to. And then you need to know that it is something that is very important in your body, because the health of your bone also affect how long you will live. Thank you.
Yes, thank you so much, sir. This has been, honestly, I can't think of any other word but wonderful. If nothing, I have enjoyed hosting this podcast.
Thank
I
you.
have learned a lot. The mental picture of my skeleton, my bone has completely changed. I think even if I don't take anything away from this, I'm taking away the fact that my bones are living organs. That has changed so much for me. And I'm sure it has done the same for our audience too. Thank you so much for following us on this series so far. Like I said, if you are meeting us here, go back and start from the beginning. There's so much to learn. There's so much to, just grab onto. And it is very interesting. And that's the thing that I love a lot about SYNLAB Podcast, that it's not even boring. We've had a good time here. And we have what we call our legacy board.
Okay.
We have all our hosts, all our guests on this podcast sign. And because we're so happy to have you here, sir, would like you to sign our legacy board for 2026.
Thank you.
So that we can tell everybody that we had you on our podcast.
All right. Thank you.
Year. While we're doing this, please like this podcast, leave a comment, leave all the comments that I've told you to leave. Go back and leave them. Share it with somebody, share it with everybody, your mom, your dad, your sibling, your friend, your colleagues, anybody that you talk to. In fact, share it on your stories, WhatsApp story, Instagram story, everywhere. Put it everywhere because everybody needs to know. This can be your gift to society as you're watching this podcast. And I'm so glad to have you. You can follow this podcast here. You can follow on YouTube. You can follow on Spotify. Thank you for being here. I'll see you in the next one. I'm signing out as Patsy Mokungah, your host. Thank you.